So it's often used a lot in agility dogs and show dogs. It can help them, agility dogs run and jump more effectively during trials, and show dogs tend to move a little easier in the ring. If you're doing the same motions and actions over time, they're going to put stress on certain parts of the dog, whether it be joints, knees, elbows, so these would be areas of concentration for acupuncture. How many treatments are needed? Every animal is different. If it's an acute injury, you can get away with usually much less treatments. If it's a chronic condition that's been developing over years, you're not going to change much with just a few treatments even. One treatment for a dog that's had arthritis for 10 years is not going to change the world, right? You're upregulating the body's own compounds, natural compounds, to be released. It takes time, it's cumulative. So initially we do at least 4 weekly treatments. That's the minimum to even see an effect. Sometimes you'll start to see it a little sooner, but it's very gradual and it's built up. So I tell people to give it at least 6 treatments before you discount it. And they are subtle, and sometimes people do it and then they'll notice that the dog, you know, had a little regression, and then they'll bring them back sooner. But 4 to 8 weeks initially. You start pushing out the animals, seeing them less as soon as you start to see a response. So it's weekly or bi-weekly till you start to see a response, then you just push them out. Ideally, you want to get to maintenance type treatments. Does it hurt? The acupuncture needles really results in little or no pain. Once the needles are in place, the animals generally relax. The first treatment, they're always kind of like, what are you doing back there? But then, honestly, after they've had a few treatments, they get it. They feel better after them, and they relax. They start to look forward to the treatments. Acupuncture in this country, in almost all the states, I think, is to be practiced only by veterinarians. Obviously, if they're certified by an organization, that's ideal because, you know, they went through the proper training. And this is just a look at how I look at a potential acupuncture patient or client. I do a Western exam, which is a conventional exam with my stethoscope and all that, eyes, ears, palpation, as I was trained in this country. And then I look at it as on an Eastern or Chinese perspective. And that's using traditional Chinese veterinary medical approach. So I'm going to be looking at what's the excess or what needs to be tonified, where's the deficiency, and then try to figure out, is this a kidney qi deficiency, a spleen qi deficiency? It's a completely different theory and way of looking at things, but it's interesting how when you look at it in this approach, how all the little disease process that the animal has comes together. So how do I figure out what's going on in an Eastern perspective? I'll palpate along the meridians. If it's tender in a certain spot, I'm going to ask, where am I? Am I on a spleen meridian, or am I on the liver? Now the organs, even though the meridians are named for organs, the organs in Chinese theory do not necessarily have the same function that they do in conventional medicine, okay? The liver, for instance, you've got a grumpy dog, that could be liver heat. You know, they name things differently. If you have muscle loss, that can be a spleen qi deficiency. The cats and dogs with kidney disease also are prone to arthritis, so that's a kidney qi deficiency. It works a little bit different. So even a dog that's nervous a lot, that would be heart shen. So even though, you know, we're saying, okay, it's along the heart meridian, it doesn't necessarily mean the heart is in heart failure or anything like that. But on a Chinese perspective, I want to tonify maybe the heart in a nervous dog, and the kidney too, because that's actually dogs that are water dogs are associated with the kidney and have a lot of anxiety. I would probably try to tonify a kidney and heart shen.